how are you?
Hi, good. How are you?
So my name is Nurse April, and I will be taking care of you today.
Hi, Nurse April. My name is Amber,
Amber.
ASMR.
And what's your date of birth, Amber?
It's 30th of April, 1991.
Oh wow, that's nice. My birthday is on April 27.
We're close. We
Yeah.
should celebrate.
So I see here in your chart that you've been feeling a little bit sick. That's why you came, right?
Yes, I've been experiencing some headaches lately. I've been under a lot of stress. I've been working a lot, and I don't know if it's related, but it's been bothering me, and it's kind of interfering with my daily activities.
Okay, I'm sorry about that. So because you are a new patient, I will ask you some questions, okay? Is that okay?
Sounds good, absolutely.
Good. So do you have any other symptoms or problems beside this?
Sometimes I feel like congestion, like a pressure here and maybe here.
Do you feel some puffiness as well?
Not really.
Okay. Amber, do you have any allergies?
Not that I know of.
So no allergies. Are you taking any medications right now?
No, none.
So no medications.
Occasionally I'll take an ibuprofen for pain.
Okay. Do you have any cough?
No.
Okay. Any swelling recently?
No.
Any fatigue lately?
Yeah, I feel pretty tired.
Any surgeries in the past 10 years?
No.
No. Any accidents?
No.
No. How is your hydration? Are you drinking enough water?
I don't think so. I should, but I don't have enough time, so.
So just try to make more time. So I'm going to ask you some questions now regarding the family history.
Okay.
Is somebody in your family have any heart problems, diabetes, cancer?
No. No, just some hypertension on my mom's side. That's nothing major. It's under control, under medication.
Okay, got it. So, okay then, so because you're a new patient, I will do a head-to-toe assessment to make sure everything is fine. So I'm also going to check the cranial nerves to make sure everything is intact, okay?
Sounds good.
So I'm going to take your temperature to make sure you don't have a fever, especially after you told me about the symptoms. So it's 98.1, that's fine. And this is going on the index finger. It's going to measure the heart rate and oxygenation level. Let's see, how's your pulse? Still working? Okay, so oxygenation is 97 percentile of room air, and the oxygenation is 99 percentile of room air. That's perfect. So I'm going to check your heart and lungs. Can you please take a deep breath in and exhale? One more time, please. Okay, good. So you have a normal rhythm of the heart. I heard just S1 and S2. Now I would like to check your face because you said you have some congestion, and I want to make sure you don't have nothing else to be worried of. Okay? So I'm going to put my gloves on, and I will start by palpating your face. Just let me know if you feel any pain or any tenderness.
Okay.
So Amber, try to relax, and if you want, you can close your eyes. I'm gonna slightly touch your face. So you feel some congestion here.
Yes.
Any pain above the eyebrows?
Tiny bit. It's like a little bit of pressure.
Any pain here?
No, it actually feels really good.
I'm gonna palpate your neck to make sure you don't have any swollen lymph nodes. Any pain around the ears?
No.
So I don't feel any swollen lymph nodes, that's great. And also your face looks very normal to me. I don't see any redness or any inflammation, maybe just a little bit above the eyebrows. But otherwise, your face, your color looks great. It's very symmetric and pink. So I also want to touch your thyroid to make sure it's okay, but I see you have something here. Did you have any accidents or any?
No, I think when I was a baby I had some sort of infection and it popped somehow and it left a mark.
But you didn't have anything else more serious? Or?
No. Yeah, it was a long time ago.
Okay. Okay, can you swallow for me, please? Okay, great. I'm also going to check your neck here and your clavicle bone. Okay, great. So I also want to check your vision and your ears. So this is a Snellen chart, so if you want to keep it in your hand, just extend your arm and cover one of the eye and try to tell me what letters do you see here.
F, P, H, F, S, B, J, H, D.
And what numbers do you see?
20, 40.
And what color is this one?
Red, green.
Good. And can you switch now? Tell me what letter. Actually, can you read the very last row?
Sure. L, T, F, P, H.
Okay. You have a very good vision actually so far. So I also want to do a few more tests regarding your eyes. So I'm going to come very close to your eye. I want to check inside your eye. Is that okay?
Sure.
Okay, and now I'm going to lift it up a little bit, your pupil. Good. Checking down. Checking your pupil. Great. I wanted to check for anemia or for jaundice, but you don't have any of those. Can you now look at my nose? Great. Great. Can you follow the light with your eyes only? Perfect. I think you are the first patient that responded so good to the vision test.
Great. It's a good sign, right?
Yeah. So let's move on to the ears. Did you have any problems in the past regarding the ears or any infection, any hearing problems?
Never.
Never?
Never, no.
Okay, so I will put this inside the ear and I'm just going to take a look. If you feel any pain, just let me know, okay?
Okay.
So, yeah, stay like this. Tympan membrane, it's pro-gray. You don't have any wax here, no infection, no redness, so that's wonderful. So I'm going to check the other side. Okay, you do have a little bit of wax, but everything looks great and normal. So I also want to check your hearing test now. I'm going to check your hearing, like I said. I know you said you didn't have any problems, but I want to make sure everything is fine because you're a new patient. So let me know if you hear anything.
Yeah, like sound, sort of.
Good. Tell me when it stops.
It's just stopped.
Good. So let me check on the other side as well. Do you hear it?
Yeah.
Tell me when it stops.
Stop.
Good. And tell me now which one do you hear is louder, position number 1 or number 2? So this is number 1 and this is number 2.
Number 1.
Good. This is number 1, number 2.
Number 1.
Great. So Amber, is that okay if I just take some measurements of your head and a little bit on your shoulders? Okay. Okay, so it's 54. I'm going to check your face, take some measurements. Okay. 60. Okay, and now I'm going to measure. Okay, and can you extend this arm in the front? Just extend it. Okay, and the other one, please. Okay. Is it okay if I just check your hair a little bit?
Sure.
To make sure you don't have any infestation, or I also want to check your scalp to make sure you don't have any messes or any lumps.
Okay.
Okay. And would you mind if you just lower your head a little bit? Your hair looks so strong and healthy. Just relax now. Also see some baby hair. Is it okay if you turn your head this way? Your hair is so rich and beautiful.
Thank you.
Okay, so everything looks great on this side. I'm going to check the other side as well.
It feels good.
I'm sure. Okay. So I also wanted to ask you, did you had any problems in the past regarding the taste and smell?
Yeah, actually, you know what? During COVID, I experienced some taste issues. Like I couldn't taste the food, and then it came back. But recently, I feel like maybe like when I eat meat or stuff like that, I can't really feel the taste for some reason.
So just with the meat or with something else?
I notice it more with meat, but I can't tell about the other type of foods if there's much of a change. But I definitely notice it when I eat meat. That it's like tasteless.
Okay, and what about the smell?
You know, because I'm congested, sometimes I don't really feel the smells as I used to. I'm guessing, you know, something's going on there, and you know, my friends would say, "Oh, something smells," and I don't really feel it that much.
And did you notice this now for a long time, or it just happened for a few days?
It's been a couple of weeks now.
A couple of weeks.
You know, I think about it. It's probably when the headache started, about the same time.
Did you get any treatment before?
For COVID or
No, for the symptoms, for the taste and smell.
No.
And for your nose, are you using any nasal spray that might help?
Or
No,
not really. I didn't know what to use, so maybe you can help me with that.
So if you mention this, so I'm going to check your taste and smell, and then I'm going to take maybe a sample from your throat to make sure you don't have COVID or any other problems. Okay. I'm gonna put one drop inside your tongue and just try to identify it. If you can't, it's fine. Just try to identify it, okay? Just stick your tongue a little bit.
I don't know, is it?
It's sweet if you...
It's a little bit sweet, like sugary, like a syrup.
Yes. So do you know like what flavor or not really?
No, I can't tell. Not really.
Okay. Now, this is for your smell. So just try to identify the smell. Take a deep breath in.
Okay, is it like lavender?
Yes, it is. So
Smells good.
yeah. So you're doing good with the smell so far. And this one?
This one is really sweet. I don't know
It
what
is.
it is. I can put my finger on the exact.
Okay, just try one more time.
Is it like cherry?
Yes. So tell me, how do you feel the globe? Do you think it's warm or cold?
It's a little cold actually.
Cold? How do you feel it here?
Warmer.
Warmer?
Yeah.
I will put it on your forehead. How do you feel it here?
Cold.
Cold? Going down on your cheek. How do you feel it?
Cold. Really
Cold?
cold.
Okay, let's see on this side. How do you feel it now?
Cold, but it's warmer on
So it's warmer on this side.
right here, yes.
Okay. What about here?
Cold.
Cold? Let's see how you perceive this stimulus regarding the sharp or dull. So if you give me your hand, I'm going to show you this is sharp and this is dull. So I'm going to use it mostly on your face, okay? So you can close your eyes if you want and tell me, how do you feel this?
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Are you ticklish?
Yeah, that feels good actually. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp.
Okay, wonderful. So you're doing very good. You just felt this a little bit of misunderstanding. So on this side you feel it warmer than it is. So is it okay now if you lay down and I'm going to check your abdomen and then your back.
Okay.
Just try to relax. I'm going to palpate your belly and then I'm going to listen, okay?
Okay.
So if you feel any pain, just let me know. Good?
Okay.
I'm going to slowly palpate and then I'm going to do a deeper palpation. So I'm going to check your kidneys. Okay. And I'm going to do a deeper palpation. I'm going to, on your ovaries, let me know if you have any pain. Is this okay?
Yeah, that's fine.
Okay, good. Okay, wonderful. So I'm also going to check the thoracic cage. Good, looks intact. Great, I do hear some gurgling.
I think I'm hungry.
I'm hungry too. So like here should be the liver. So I'm going to press down. Let me know if you feel any pain. Is okay?
That's okay.
Okay, perfect. So I do see you have a lot of moles. So you need to be very careful to make sure you check them all the time, to make sure they are not changing the color, they are not elevated. Did you see the dermatologist before?
No.
I see you also have a small tattoo. Okay, otherwise your skin looks great. So I think this is the biggest one, but this one, for example, is a little bit elevated. You said this one?
Yes.
And you do have a few that are very, very small. Okay. So I'm going to listen to your belly now. Just try to relax. So normal activity of the bowel, I just heard some gurgling, but otherwise everything is good. So I'm also going to check your skin to see how elastic it is, to see if it's good hydrated. This is like a pinching test. Good. And I'm going to check the sensations on your belly. So tell me if you feel this on the right side or on the left side.
Left side.
Now,
Right side. Left side. Right side. Left. Left. Right. What about now? Both sides. No, both sides. Left side. Right side. Left.
Great. And tell me if you feel this sharp or dull. Sharp or dull?
I don't feel. Oh, the one that you just did?
Yeah.
Sharp.
No?
Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull. Sharp.
Okay, great. And lastly, I'm going to take some measurements, and then you can flip over to check your back. Okay. It's 46. Good. Just to measure the belly button. Okay, just want to make sure belly button is well centered. I don't see any redness around. Everything looks great. Okay, perfect. So now you can flip over and I'm going to check your back.
Okay.
Tell me if you have any pain.
No, it feels good.
So far your spine is straight. I didn't feel any abnormalities. And no deviation so far. More moles than on your belly, I think.
Yeah, I have them everywhere.
So I think it's best to see a dermatologist because you have too many to make sure they are evaluated properly.
Okay.
Good. So I'm gonna tap on your back a little bit. Okay, so everything looks great on your back. So I think when you want to, you can stand up and we're gonna discuss the results of this exam.
Okay.
So before we finish the exam, I would like to take a swab from your neck to make sure you don't have any virus that's going on right now, okay? So I will call you with the results in a few days, maybe in 2 or 3 days. So just open your mouth Okay, just a little bit more. Okay, perfect. So I'm going to send this to the lab and I'm going to let you know.
Okay.
So let's see, Amber. You are very healthy, you look very good, you are young. And just I'm a little bit worried about your moles. You have a lot on your belly, but more in the back. So I will give you a referral to see a dermatologist because you said you never went to see.
No.
Okay. So, and you didn't respond it so good to certain stimulus, but we'll just monitor and we'll see next time how are you doing, okay?
Okay.
Do you have any questions regarding today's exam?
No, I don't think so. It felt pretty good.
Okay.
It's nice.
So if everything is good, then we're gonna see each other in 1 year, okay?
Okay, perfect.
So, okay. So thank you so much for coming.
Thank you for having me.
Take care.
You too.
Bye-bye.
Bye.